Hi, my name is Maria Manitou, and my grant proposal presentation um, addresses the African American population in Detroit, Michigan. Um, the health issue is cardiovascular disease, and cardiovascular disease is a collection of different types of vascular disorders, and it can include strokes, heart attacks, and vascular disorders. We know that according to the American Heart Association, that there are disparities when it comes to the condition, where 30% of the African American group is more likely to die from heart disease. The prevalence of high blood pressure among this group is 40 times percent more likely, and the obesity rate is 1.3 times more likely relative to other ethnic groups. Cardiovascular disease is the leading cause of death in the nation, but again, African Americans are most affected, or affected more frequently. This is a problem because the trend is continues to increase, and this problem is increasing the prevalence of disabilities, and more African Americans are dying at an early age due to this condition. There are social determinants of health that influence the condition, such as access to primary care. In Detroit, we noticed that there is a ratio of 1,310 physicians to patient, compared to 1,240 in the state. The educational attainment, according to a 2021 statistical census, indicates that Detroiters have a high school completion certificate of about 21% relative to the nation, which is 87%. And this is significant because the degree of knowledge influences the health status of an individual. So we see that the cardiovascular disease is affecting various levels of the socio-ecological model at the individual, at the population level. Is increasing the cost of health insurance and healthcare. And then at the organizational level, hospitals are more in demand for tertiary care, which requires more complex procedures and increasing the healthcare cost. Health behaviors in the population, we notice that 50% does not engage in exercise activity and 38% is obese. The good news is that we know that protective factors to the condition include exercising and proper nutrition. For those diagnosed with the condition, we will look into adherence to blood pressure medication. We look into Healthy People 2030 to guide our plan for an intervention program. And there is a population in the city of Boston with similar characteristics, and it involved the African American population, and their intervention had successfully reduced the incidence of obesity and blood pressure. The name of the program is Be Fit, Be Well, and we look forward to implementing and adapting that program to our population by promoting training and educating participants on weight management. What's unique about this program is that weight management is being conducted from primary care facilities where participants do not have to go to a gym to seek advice and guidance. Of course, in our program development and evaluation, we need to engage the community and stakeholders because they both play critical roles throughout the entire process. For example, to study the needs assessments of the community, it's important that we identify what sort of resources in what the community perspective is on the health issue and their needs. Something that program planners may be totally unfamiliar with. And getting to know the community is critical because they will be guiding the program, and they're the ones that are utilizing the services, and they will benefit from the potential benefits of the program. Engaging the stakeholders at all levels is also critical. For example, in the implementation of the program, because they can guide with their expertise in knowledge and skills in terms of whether the program was appropriately implemented or not, what sort of accomplishments did the study produce, and there is an ownership in which both community stakeholders and stakeholders add credibility in terms of also advocating for the program. We were guided in the intervention by the BFIT Be Well intervention program, and influencing the factors that contribute to the health outcome of cardiovascular disease and the impact of those factors, and how the intervention influences each to reduce the rate of disability and death. An overview of the program is with using the logic model. And for example, the participants' criteria is to be obese, hypertensive, and using at least one blood pressure medication. The activities of the program involve a visit with the primary care provider, and it's a baseline activity in which the provider guides the individual with providing them with a prescription to the intervention program. So this is kind of unique, in which each participant will receive a prescription and promoting healthy behaviors. The activities also include the distribution of pedometers and the health outcomes that we look forward to is to reduce the rates of obesity, hypertension, and our aspirational goal is to reduce the rates of cardiovascular disease. We're also looking to short-term outcomes in terms of increasing the interest in walking and the interest of consuming fruits and vegetables. Our medium-term outcomes is to engage the population in participating for at least 10,000 steps in a day and eating at least 2 cups of fruit and vegetables each day. Our objectives are guided by those outcomes, and we ask if there is an increase in walking steps by 10% by year 1. Another objective that we have is that we can reduce the rate of or we can reduce the levels of blood pressure by 10 points by year 1. And the other objective guided by the goals is to reduce the percentage of obesity by 5% in the population by year 1. In the process evaluation, we engage again the stakeholders and the community to verify that the program is being implemented appropriately. We check on activities such as did they receive a pedometer, and the participation did we engage the African American population, which is the intent of the program. And we verify the number of the initial enrollment. For the effect evaluation question, we look into the participants' interest increase in walking activity, the participant engage in the 10,000 steps goal or objective, and was there a decrease in the incidence of hypertension, obesity, and cardiovascular disease, which will be our final assessment. The evaluation design that we implement, it's a cohort study in which 2 groups are being followed over time, and and we verify if there was a increase in daily walking activity by 10,000 case steps a day, and we collect data to analyze the intervention program. Another effect evaluation, we utilize a pre-test, post-test evaluation design, and we verify if there was a weight difference between the participants and those actually not being exposed to the intervention. Our program is guided by the CDC evaluation model, and that will guide us for a systematic approach, obtain credibility of the program, make sure that the data that was collected is actually credible, and if that data can be reliable to be translated to other groups. We use a certain standards like feasibility and accuracy on the program again to make sure that the data is actually credible. And throughout the process, we examine all of these steps to make sure that we are continuously improving the program. Thank you for your time, and I thank you for your financial advance support. And I hope that we can empower the population, the African-American population in Detroit, to achieve better health and reduce the incidence of disability and mortality. Thanks.